Hello, my name's Lance Little. I'm the Managing Director of Roche Diagnostics Asia Pacific. At Roche Diagnostics, we're part of the Roche Group, and we focus on informing clinical decisions through the utilization of diagnostic tools, focusing primarily on laboratory testing and in-home testing where it's appropriate, where the testing needs to be done close to the patient. So COVID-19 has reshaped the diagnostics industry and what I would describe as perhaps accelerated the diagnostics industry. So infectious diseases are not a new thing for diagnostics. The diagnostics industry we see as the foundation of healthcare, and it covers both non-infectious diseases and infectious diseases and many other diseases. So for us, infectious disease in itself is not a new dynamic. What COVID-19 has done is it has shone a spotlight on the world's healthcare systems and how well established the diagnostic element of those healthcare systems are. In other words, a key part to COVID-19 management, pandemic management, has been testing. Now, where we have countries with well-established healthcare systems and the diagnostic testing is set up well and the infrastructure is integrated well, those countries have been able to manage this pandemic perhaps a little more effectively than those countries where the healthcare system is perhaps not set up quite so well and diagnostics is perhaps not as well established within that healthcare system as a whole. So there's been I guess an acceleration of tools that we already knew were there and were slowly being adopted. Things like digital tools in diagnostics have been utilized far more aggressively as a result of COVID-19 than they were pre-pandemic. For example, getting test results in the hands of the patient is something that was not always common pre-pandemic. However, now it's vitally important. So we're seeing tools that enable this transformation of diagnostic information from the institutions into the hands of the patients themselves. Sustainability will absolutely feature, and I think sustainability can be looked at many different ways. From a supplier perspective, one of the key elements that we look at is, for example, is sustainability of manufacturing and supply chain. What we found with COVID-19 is the speed with which we were able to manufacture the tests that we provide is phenomenally quick compared to the normal pre-pandemic process. And then also working with regulators to be able to get emergency access for those tests to ensure that they're safe, but importantly, get them into the hands of the clinicians so as they can make use of them as fast as possible is key. Now, so from a manufacturing perspective, we've taken the learnings from that, and that's reshaped our thinking of how we manufacture, how we scale production. Then, of course, what came to light with COVID, because of its worldwide nature and the effect on the transport routes, then this question around supply chain sustainability comes up as well. So we're taking the learnings from this as well to ensure that not only can we get products from manufacturing site to the clinicians and the hospitals, but importantly, can we get the raw materials? Can we ensure that the components we need for building the analyzers can get to our manufacturing sites? So sustainability around manufacturing and supply chain are two elements, but then there's of course the healthcare impact itself. And we saw some countries who were able to almost segregate the COVID load on their healthcare environment from routine patient load. And I think those countries have been able to manage this much better. So they were in a sense more sustainable. In other words, countries that were not able to segregate these two populations of people, if you like, really had a huge impact. For example, patients going in for oncology treatments couldn't go to a hospital because that hospital was dedicated to COVID, for example. So this has raised questions around the sustainability of the healthcare system itself when you have a global pandemic of the scale of COVID hit you. And so I think these are questions that are continuously being looked at, and some of the learnings that have coming out of the pandemic so far, I think will ensure that moving forward, we end up with more sustainable healthcare systems. And we firmly believe, as I said earlier on, that diagnostics is a key component of that, because no matter what the disease is, whether it's being able to manage a chronic disease, whether it's being able to treat people with cancer, whether it's being able to manage an acute pandemic like COVID, testing becomes all important in this. So I think the opportunity for ASEAN leaders with what we've learned and what we continue to learn here is communication and connection is key. So, for example, if I look at the regulatory framework, where we have countries that work well together and one regulator has put in the systems in place to ensure that a test is safe and available for market, then perhaps we can work better to make sure that other countries who understand and respect those tools that country A is using, then maybe we don't need to reinvent the wheel and we can get the products into the hands of the clinicians faster. So this communication and collective approach across borders, I think, is going to be key.